Hey everybody, my name is Esther and I have Parkinson's disease. And I'm also a healthcare administrator. And this is the last week that I will be working. I have decided to retire early and focus on Parkinson's advocacy. And I was thinking today, I was reflecting on my career today and thinking about something called bias. We talk a lot about bias in healthcare now, anchor bias, implicit bias, zebra bias. We all go through tons of trainings about bias. I'm going to start making a series on this topic to hopefully kind of give people some insight into where your healthcare provider is coming from. Because a lot of people express frustration to me about the system, and I have my own frustrations now as a patient. So my father was a surgeon. I have two sisters that are nurses. Pretty much all my friends are either doctors or work in healthcare in some way, shape, or form. And my husband is a doctor of pharmacy. And I think people forget, number one, that people in healthcare are just people like everyone else. And there's good ones and bad ones. But there's something that happens in healthcare that bothers me more and more, and has made me realize that it's almost impossible for me to do what I've always done, which is when we discuss and make decisions that affect patients in healthcare, there is very little, if any, representation from patients. It's kind of absurd when you think about it. I was thinking today about the analogy of like a dog groomer, right? So if there's somebody that could give you insight how to be the best dog groomer and make the dog the most comfortable, it would be the dog, right? But nobody can talk to the dog. And in healthcare, it's the same. But we can talk to the dog. We can talk to the patients. Like, stick your head out of the office and grab one. But we don't do that. Great healthcare organizations do that. Mayo Clinic, Cleveland Clinic. Those organizations that we all aspire to be, especially people like me that work in quality, we want to be those organizations, but we can't. And I'll tell you why. We don't have the staff, and we don't have the money, and we don't have the time. Because in most hospitals, all the ones that I've worked at, everybody's already doing the job of 3 people. Now, it didn't always used to be that way. You talk to anybody that's worked in healthcare for more than 20 years, and they'll tell you about the halcyon days of lore of yore, where we didn't work like 3 people, and we had help, and we had assistants, and we had project managers, and we had staff. But over time, that has been eroded. It's just slowly but surely been taken away from us. When I started in quality, actually I started in what's called safety, patient safety. When I started in patient safety, I had probably 4 people under me, and I had a full-time assistant. And at the time, there was some kind of shift that happened. And if we're being honest with you, it's probably correlates to the advent of the Affordable Care Act, which is a whole nother thing. I'm not going to get into politics and things like that. But it did time-wise correlate with 2 things: the advent of the Affordable Care Act and the advent of venture capital entering healthcare. So what were often maybe physician-owned hospitals or privately owned entities eventually just began getting acquired by these larger corporations. And the function of the corporations was to reduce cost and increase revenue. I mean, that's what corporations do. And again, I'm not making judgments about things like this is capitalism. We're not communists. But and I was in the rooms when the discussions were having again and again about where can we cut? So where did we cut? Patient advocacy, quality improvement, safety, staffing, education, training. Back in the day, we all used to go to conferences, a couple times a year, regionally and nationally, get new information, all that good stuff. And that's just not a thing that's budgeted for anymore. I used to have, with my job, somebody that just did safety, somebody that just did compliance, somebody that just did infection control. And over time, all of those job functions, they just got melded into one position. And at the time, it was like, well, cost saving. But I think over time, we've realized, or should have realized, that the implications of those decisions is dire, right? And it's not just in quality, it's in nursing, it's in physicians. I mean, you can ask any physician, they work so much harder than they used to. And as far as nursing goes, I honestly don't, I actively tell people don't become a nurse because it's even worse for them. What used to be what we call nursing ratios, so you go to a hospital and let's say there's 15 beds on that floor, and there's like one nurse for every 8 patients, let's say. And over time, especially after COVID, it's like, let's have 6 ICU patients and 1 nurse or something crazy. I mean, I'm not a nurse, and I'm not working in a hospital right now, so I don't know exactly where the ratios are now, but they got worse. Everybody can agree with that. And the nurses are upset about that. And the doctors are upset about that. So it begs the question, like, who's making the decisions then, you know? If the priority is not patient safety and quality of care, what is it? And I think we all know the answer to that. The answer is profit. The answer is money. And it's not always just profit. It's also money in that when all this stuff was happening, our reimbursements became smaller also. So we're getting less money and less money and less money from the insurance companies, from Medicare and Medicaid, from all of those sources. So it's not all greed, it's also self-preservation, right? Because you're trying to make payroll, you're trying to keep the staff that you have, and there has been kind of an all hands on deck mentality at a lot of the smaller hospitals that I've worked with. Like, we'll just suck it up because we don't want our friends to lose their jobs. You know what I mean? So it's at, I feel, a very critical tipping point right now because, number one, patients are suffering, I believe, at record levels. Quality is suffering, and the population is rapidly aging. And so the system, especially after COVID, is so much worse. Everybody I know is so burned out. And the solutions that are on the table as far as, trying to get more nurses, trying to get more doctors, etc., is not going to work because they're not going to stay. Healthcare, the beauty of it used to be that you made good money and you had a good quality of life. But that's not that true anymore. And I really do believe that it's up to us as the patients to A, demand more, but B, advocate for change. And that's my goal in doing all this, is to make people realize that doctors and nurses and patients want the same things very desperately, but our hands are tied in so many situations. Even if it's just the fact that the nurse, for example, is rude to you, or the doctor is just a crummy doctor, this is still a financial decision. We can't get rid of the crummy doctors and nurses because we don't have anyone to take their place. And that's the larger issue. So I'm going to start posting this stuff on YouTube. I'll put it in my link tree. And I hope at some point that people will join me in advocating for change, because at some point we're all going to end up in the system and there's a lot of work to be done. So I hope this helps.